Should I be doing just the important questions or should I do the entire book? This question has been plaguing philosophers since millennia. I am Rohith PVR, a third year medical student in Madurai Medical College, and in this channel I make videos mostly related to MBBS medical school stuffs, and alongside I make videos about productivity, spirituality and some of the favorite books that I read. So if this sounds like a cup of tea, then do hit the subscribe button. So what are important questions? Important questions is the collection of the set of questions that have been asked in the previous question papers. When I first got into medical college, I thought that I should be doing the entire book, page to page, because that's how I've been taught. Since my childhood till 12th standard, I have only been practicing this one thing, like completing every single page, word by word, from the start till the end, A to Z. So that's what I have been doing. So when I got into medical college, I was trying to do the same thing. But only then did I start to realize that it is a very stressful work, and in fact, it is impossible to actually do it. I'll explain why this is actually impossible. First of all, it is very stressful. It requires a lot of work. It's pretty obvious. We have a lot of books to study. That's one thing. It's fine. It's fine. I can put the work. We can do the hard work. You can do the hard work. You can finish all these books. It's fine. But is it worth it? That's the question we are talking about, right? It's okay. We can study all these pages, but is it worth it? And I'm saying that it is actually impossible to go through all of them. Yeah, we can definitely read every single page, but it's definitely impossible to recollect all the information, right? Medical curriculum is not actually finite. It's infinite. There are 1,000 pages book on simply parotid gland. Like parotid gland is this small gland, a small salivary gland over this region. You literally have 1,000 pages of content simply about parotid gland. That's how humongous the entire medical curriculum is. So you need to know what to study. That's where the important questions actually come in. So you can go through the important questions, look at the important questions for one time, and then decide that okay, this is actually something important to study. So for example, the important question bank will say that you have to study facial nerve. Okay, so you will study facial nerve in detail, but you don't actually need to study spinal accessory nerve in detail, because it is not really that clinically significant. It is not really that clinically relevant. I have not seen a single spinal accessory nerve till date, but I have already seen 5 to 7 Bell's palsy cases. Bell's palsy is the condition in which your facial nerve doesn't work properly, so your face will get deviated and stuff like that. That's Bell's palsy. So I have seen Bell's palsy like 5 to 7 already. Like I have just been into medical school like 3 years, and it has been just 2 years since I like started seeing patients, and already I have seen 7. So just see how important Bell's palsy could be. So when you go through the important questions, it is clear that Bell's palsy is something you have to know. It is the basic. Understand the psychology, understand the mind of the examiners. The examiners want you to pass. They want doctors who have the basic information, basic knowledge. They want doctors who can solve the current problems. They want doctors who can solve the day-to-day problems. For example, you need a doctor who can give you paracetamol when you have fever. Yeah, I mean nowadays everyone gives paracetamol to everyone, but you need a doctor to give you this particular drug for gouty arthritis. You need a doctor to give the particular drug for heart attack, for angina. You need a doctor to know that nitrates can be given for acute attack of angina. So this is what a doctor should be knowing. He doesn't need to know that what happens if this one single artery has a clot within it and what to do. He doesn't actually need to know that. He needs to know the most important things, and that's where the important questions help us. So I will call the important questions not as a question bank, but as a guide into the journey of MBBS. See, this MBBS journey is literally vast. It is humongous. We can go through any path, but the question banks, but the Q bank, the important question bank, it will actually navigate. It will help you navigate through this humongous path. It shows you the most effective way. You can literally read everything, but it's a waste of time. It's a lot of hard work, unnecessary stuff, and also we need to have some fun, right? We also need to go to the gym. We need to hang out with our friends. We need to have some fun. It's not only about studies, right? We need to have some fun alongside. So the question bank will help in that. But I'll definitely ask you not to just ratify, not to just memorize every single word that's in the book from the question bank. Try to read the entire textbook. You don't actually need to remember and like keep in your head the entire book. You can just read the entire book, and whenever the important questions come in, try to focus a little bit more. Try to understand the concept a bit more. There's no mistake if you don't understand a non-important question, but it's a humongous mistake if you don't understand an important question. You need to know what's the first nerve from facial nerve. You need to know what supplies the tongue, what's the nerve supply, what's the motor supply. You need to know everything. They are very important, right? I'm going to ask you to read the entire textbook, but keep in mind that you have these important questions and you have to focus a bit more on these important questions than reading the entire book. At least by the end of the year, you don't actually need to go through even if you don't go through the entire textbook, at least make sure that you're done with all the important questions, because these important questions are the practically relevant questions. The examiners will mostly be asking practically relevant stuff only. They don't want you to know about some random cancer that arises in some random place in our body. They want you to know the important cancers. They want you to know what is NPC, what is angiofibroma. They want you to know that. They don't want you to know anything else. So make sure that you are completing all the important questions, but also try to read the book because it will give you some more confidence. And this is a playlist of videos in which you can find a lot of videos about how to go through medical college in a very decent way. So make sure to check it out. And as always, thank you for watching, and I'll see you in the next video.